So, is it safe to have intercourse during pregnancy? Hello and hi, this is Dr. Shamanti Reddy, fertility specialist and gynecologist at Shubha Fertility, LB Nagar. So, is it safe to have intercourse during pregnancy? This is a very common question asked by the couples when they are pregnant. So, basically, it is not an absolute contraindication to have intercourse in pregnancy. Generally, the first trimester and the later third trimester are very important in a pregnant patient. So, first trimester with very early weeks of pregnancy, what happens is the baby is just getting implanted or it is just growing in that early weeks of pregnancy. Frequent intercourse might lead to uterine contractions and unnecessary miscarriages might happen. So it is not an absolute contraindication even in first trimester, but only thing that we advise is to have a lesser frequency, not to have regular intercourse. Lesser time, less frequency is better. And if you have spotting or bleeding during the first trimester, it is all the more alarming, and it is advisable not to have intercourse when you have spotting or bleeding. And then comes the second trimester. Second trimester is very safe. You can have intercourse. There is no issues unless you have any absolute contraindications. If your placenta is low lying or your obstetrician is advised you to have a bed rest, then you should avoid. And third trimester, coming to third trimester, when it is around 28 weeks to the end of the till the delivery is called third trimester. So in third trimester, there also there is no absolute contraindication that you should not have intercourse. Only thing is that you have to check the placental position. If it is low lying placenta, it is always better to avoid intercourse. It might lead to bleeding and might lead to hemorrhage also. And next comes if you have any history of recurrent pregnancy losses. Sometimes we advise it is better to avoid. And if you are categorized as high risk pregnancy, it is always better to avoid intercourse in such cases. And there is a minimal chance of any leakage of amniotic fluid. That is the reason we tell them to have a lesser frequency of intercourse in third trimester too, because it is a very important period. You are almost getting ready to the delivery. So only thing is it is not absolutely contraindicated, just the frequency is important. Thank you, and follow me for more content.